Pickleball is America's fastest growing sport. It has unprecedented growth, including right here on the Suncoast. I will attest, it is very fun and easy to learn for all ages. My whole family plays together. But anytime you get active, you also run the risk of injuries. Dr. Christopher Sforzo is an orthopedic surgeon here to help us stay healthy. Great to see you.
Thanks so much for having me.
So I'll admit right away, I was a tennis player early on in life. I have hurt myself playing tennis. Pickleball is much easier on the body. Explain to people who are a little hesitant how it is actually a little bit of a gentler sport.
Yeah, no doubt. I mean, pickleball, the court is smaller. The movements for the shoulder, the hand are all a little bit less. And also the pickleball racket is smaller, so there's less chance of injury because the lever arm, I don't want to get too technical about the mechanics, but the lever arm with the ball striking the paddle is a little bit less injury, can potentially cause less injury than tennis.
Yeah, I feel like as a tennis player, when I play pickleball, because I definitely got hurt playing tennis year after year after year, pickleball has been gentler. However, anytime you get active and use muscles and membranes and all sorts of things you're not used to using, you can have injuries. So what are some of the common pickleball injuries that you're seeing?
Yeah, no doubt. So what happens typically that I see with my patients, especially in Sarasota, is that you have a lot of patients, and a lot of my patients are just new to the game, and they get to Florida and they want to be social, and one of the ways to meet people is to play pickleball. And so you have a lot of people who are playing a sport that they've never done before, or they haven't been that active. And so we see, in my practice, I specialize in just upper extremity, so that's shoulder to hand. And so I see a lot of shoulder overuse injuries and mainly elbow overuse injuries. The other thing I sometimes tragically see is when patients fall. And so that can happen sometimes because pickleball does have some significant change of direction, which could happen, as you know, you've played, can happen very quickly. And so the ball will go over your head, or it will go behind you, and then you'll make a sudden movement, and then that can lead to a fall. And so those are kind of the three most common things that I see in pickleball.
And unfortunately, anytime you get active, there's a little bit of risk. But I feel like we still need to really encourage people to be active because if we were to have an injury, it is something that can be fixed.
Correct.
So let's talk about that. When people come to you with injuries, be it elbow, be it shoulder, and I know you brought some things to help us along here, what can you do to help?
Yeah, so I don't want to discourage people from playing pickleball, but I think it's super important to get out and be active. So one of the most important things is to warm up properly. And so there's a lot of techniques that we can teach to warm up the shoulder, the arm, the legs, the core, to hopefully prevent those injuries. As far as injuries that can occur with the shoulder, we see rotator cuff tendonitis, we see tennis elbow, which we call sometimes pickleball elbow, of course. And then, like I said before, wrist injuries can occur as well. So I would say for the most part, people want to come and see me when they have problems that are affecting their life, whether they can't play because of the injury or the pain in their arm, whether they can't sleep at night. Very common with rotator cuff problems to have difficulty sleeping at night. Some people with pickleball elbow or tennis elbow, as you know, have trouble even pulling, you know, a carton of milk.
Microwave, picking up a coffee cup.
Absolutely. It becomes, it becomes a technique that can be very difficult, just everyday stuff.
You brought some things to show, and please hand them over.
I did.
When something happens with shoulders or wrists, what's actually happening?
Right. So this is just, these are different prostheses that we were going to talk about, because I wanted to kind of show that some people, a lot of my patients have rotator cuff problems, and sometimes those rotator cuff problems lead to arthritis. And when you have a combination of a rotator cuff disorder and arthritis, it's called rotator cuff arthropathy.
So you need to stop it before it gets to that point.
If you can. There are ways we can treat them non-operatively with physical therapy, with activity modification, and with injections, but sometimes they need to have their shoulders replaced. Sometimes the rotator cuff can be repaired in instances where the rotator cuff can be kind of moved over and it's still healthy, and the joint is still good, meaning they don't have arthritis. But if you have problems with arthritis, then sometimes you need to have the shoulder replaced.
Yeah, how does it fit together?
So there's two types of shoulder replacements. One is called the anatomic, so that's when we actually replace a ball with a new ball and a socket with a new socket. So basically we have a metal ball with a plastic socket, and that gives you a new joint. This anatomic replacement requires a rotator cuff that's intact to work. If you have a rotator cuff deficient shoulder, this is not the prosthesis for you. You need to have what's called a reverse shoulder replacement, which is a question I often get. So why do you get a reverse? You get a reverse because you had that combination of arthritis and a deficient or a lack of a rotator cuff in your shoulder.
So getting it looked at by a professional, important when you start with any kind of pain.
Correct.
So you can start to analyze where you are in the process
In the grand scheme of
life.
things, absolutely,
Yes.
absolutely, because so many patients come to me and they say, okay, I want to have this procedure done, or I definitely don't want to have surgery. And that's why, you know, I always tell my patients, I'm not a hammer to your nail, right? Everybody's individual. And so we have to talk about what you've been through, what are your expectations, what do you want to get back in that pickleball court as soon as you can, or maybe you're okay giving it up. And so those all determine how we're going to treat you.
And I think that's really honestly the sign of a great physician. I know personally I went through it. When do you get injections? When do you have surgery? I did eventually have surgery, and that's okay because it was important for me to get back on the court.
Exactly.
But you need a doctor that's willing to discuss all these options with you. And that's what we're learning today. For more information about orthopedic injuries, because guess what? They happen even though we want you to stay active, you can contact SforzoDillingham.com. We'll be right back.